Hi, Lindsay. Good to see you.
Yes, so lovely to see you too. Thank you so much for being on here with me. All right, guys. So everyone, I have somebody who is going to help us answer all of our burning questions about alcohol, especially because it is Alcohol Awareness Month. Everybody, thank you for submitting your questions, your concerns, your topics. Super helpful because as most of you know who have followed me, I'm in my own, for lack of better term, sober curious journey and have been for the last few years. And I have talked and written and interviewed a lot about alcohol and eating disorders specifically, how those two can interweave, how they can kind of like play a role when you don't think they're playing a role. And, you know, I just felt like it was really time to talk to somebody who is a professional who can answer these. And that would be Leah Young, who is the clinical manager for integrated services at ERC and Pathlight Mood and Anxiety. Everyone, here's Leah. Yeah, she came highly recommended when I reached out to ERC and Pathlight, who I do some work for. And I was like, hey, I want to talk about this. It's Alcohol Awareness Month. Like, let's get going. And they were like, oh yeah, great. Here's Leah. She'll be able to answer a lot of your questions. So how we're doing this, just for whoever's watching this right now. I collected a lot of your questions, sent them over to Leah so she had some time to look them over so we could have some thoughtful discussions around them. I don't really think I need to weave in all my personal narrative, but if it feels relevant to it, then I will. But for all of y'all, yeah, I'm just going to start asking some of your questions. And Leah, we went through them together and we asked the ones that we think are the most prevalent. As we all know, we live in this huge drunkorexia society often, even though we don't know what that means a lot of the time. And so, you know, it's been fun to watch myself and so many of you come to me with this social awareness that we're all starting to have as a collective conscious. And it's great because alcohol is an issue and we need to keep talking about it.
Yeah, we do.
Yeah. So I'm going to jump into like a couple of the questions that really stuck out to me first too. And that is, do I have to stop drinking to fully recover from an eating disorder?
Yeah. So that is an excellent question. And my response to that, for those of you who think in black and white, you're really not going to like this, is not necessarily, but maybe. And so when I'm working with folks, I really strongly recommend that we're not using any substances in early eating disorder recovery, or at least until it feels well established. And so the question from there then becomes, well, how do I introduce alcohol at a later point? And, you know, if someone chooses to do that, you know, sometimes we intend to just not use for a while, and then it kind of just keeps happening because we decide we just don't care anymore and we don't really need the alcohol. But for those of us who do want to reintroduce it, I really recommend creating a red flag warning sign list for ourselves. And that can look like anything, right? So it can be, maybe I'm concerned about frequency, or maybe it's more about the amount, or maybe it's my intention when I do drink. I think one that's really we need to pay attention to is how it impacts our eating disorder recovery. So even if I'm having just 2 glasses of wine on Friday nights with my girlfriends, if I notice that on Friday at lunch, I restrict and I skip my snack, and then I'm pushing food around my plate at dinner with my girlfriends, those 2 glasses of wine, I may not be ready for them at that point in my recovery. Does that mean never? Not necessarily. And so it really is kind of individualized. And I think if we are going to reintroduce it, we have to be prepared that we may not like the answer that we find, because we may find that we can't drink safely, can't, with a T at the end. And some of us may find that we can. So that's kind of where I'd go with that. So I guess the answer is not necessarily, just like I said.
Hopefully thank you for that. It really brought up a really interesting thought for me is when I first was in recovery and leaving eating disorder treatment. I was living in New York, and I've heard from many people that New York can be a really hard place to protect your recovery in. And I certainly felt that way too at times in that first year. And I definitely had an experience of like reintroducing wine back to my life very quickly and finding myself like drinking almost in the sense of just to quell all the body image anxiety I was still having from being in recovery. And then just the anxiety of like eating normally for me. And I found that wine was this like self-medicated way to do it. And I didn't really recognize that for years. I mean, it took like literally years for me to finally be like, oh, that's more my intention of why I'm doing this.
Yeah. Thank you for sharing that. I think that a lot of people are really going to be able to relate to that.
And thank you for your response. That was interesting, and it brought up a lot for me. So I appreciate it. I thought this one was interesting too. Is it common to have anorexia and drink too much?
Yeah, that's very specific, and I get that, right? And so I guess what I'll start with is a statistic that is pretty well founded. I don't like to just throw out statistics and research findings willy-nilly, but people who have an eating disorder diagnosis are 5 times more likely to develop a substance use disorder than those without. And really, because we all have a brain, we're all at risk for developing a substance use disorder and an eating disorder, quite honestly, because that's where the compulsion lives, right? And so when I think of compulsion, I think of that like feeling the need, almost like a moth drawn to a flame, right? And where I might even be saying to myself, don't do this. You don't want to do this. Why are you doing this? Why are you ordering that glass of wine? What are you doing? And we're doing it anyway. And so it absolutely, it doesn't matter if I have anorexia nervosa, or I have bulimia nervosa, or have binge eating disorder, or I have mood and anxiety disorder. It's very common amongst all of those. And the reasons for that are some of what you already addressed, Lindsay, is that we want to quiet some of those thoughts. We want to, a lot of us struggle with social anxiety. So we feel a little bit lubed up in a social situation. So it's absolutely common. Too common, unfortunately, because it means that some of us have this double whammy of having to take care of both.
Yeah, thank you.
Yeah.
I think that brings up another question actually that was on here. And it's like, does alcohol have more dangerous side effects when you're restricting?
Yeah. So it can. Yeah, yes, absolutely. And part of that is because when we're restricting, right, obviously our body can be malnourished in that case. And our organs are not functioning the way that they need to with the substance use that we're engaging in, as well as restricting. They're getting beat up, quite honestly. They're taking a pounding. Our central nervous system is getting kind of pounded on every day. Our vitals can be all over the place, so we can see increased heart rate. We can see issues with like that shakiness, nausea, dehydration. All of those things can be amplified when we're restricting and drinking. And those of you who've done both know that we tend to get drunk a lot faster when we're restricting. And some of us intentionally do that, right? We know I'm good. Yep, exactly. So there's an increased risk. I can't give you numbers or anything like that. I don't have that off the top of my head, but it's for sure a thing.
Yeah, and something else, just like, again, personal narrative, just throwing it in there, is the other side effect of that is like, that's not the only reason, but I got a DWI when I was 21, and I often tell this story on Instagram because I'm trying to help people understand, like, the side effects are often things you can't even, it's not even just physical, right? It's like, no, I only had 2 glasses of wine when I was 21, but I hadn't eaten well that day. Yep. And I got a DWI, and it was not way over the legal limit, but over. And when I don't think I would have been had I not, but I couldn't make that judgment call anymore because I didn't know what normal eating even was. So I got in legal trouble, and it was horribly embarrassing, humbling, and, probably changed my life in ways that I needed, but
I get that.
Yeah. Here's a good one that feels, it's vague. I think this will be a vague, it's hard to like, everyone has a specific relationship with alcohol, right? But like, how do you know if you need to address your relationship with alcohol? What are kind of the warning signs there?
Yeah, so you're absolutely right. I think individualized is what I look for. And, some people need things to become problematic with a capital P, I like to say, and others choose to address their use, even though it might not be causing any kind of major problems. I have a former patient who chose to address her use of alcohol just because of the shame she was feeling. She was drinking throughout the day. Nobody knew. She was killing it at work, et cetera. But she just felt like she was being dishonest. She felt like she wasn't being her true self or authentic, and all of that shame was enough, right? So other people, shame is not enough to get us to make changes, right? We just kind of live in it, and actually kind of contributes to our continued use or engagement. So, certainly if we're looking for warning signs, some of the things that we want to look for would be, if it's causing me distress, if other people are complaining about it, if I'm finding myself drinking or using at times of the day when it might interfere with my functioning. We want to look at some of those things. medical consequences, obviously. But I encourage people not to wait for that stuff. And really, if we're questioning our use of any substance, then maybe that tells us we should at least look at it. Does that mean that we have to quit forever? No, not necessarily. And it may not even mean that we have to quit at all, but we may want to take a look at, I might need to approach this a little bit differently. So I really, I want people to avoid the yets. Like, I don't want people to have to get to the point where they're losing their career and their friends and their family. Sometimes we do have to get there. But if we can start looking at it a little early, when in doubt, there's no doubt, is what I often say. So
yeah, I think the shame piece is huge, right? And I've addressed this in my own personal experience of like, when I first, like the first couple times I quit drinking, right? Like I made these grand proclamations about never drinking again and like how I was so done with alcohol, and then found myself drinking 3 months or 4 months or 5 months later, like not a lot, but like like at the time a little. And then I was trying to like hide it. Do you know what I mean? Almost because of the proclamation I had made on Instagram and to my friends, like I didn't want to seem like I don't know. It was like, and then I felt like it was this black and white of like, oh my God, wait, I don't think I'm an alcoholic. I know how to, like I felt like I didn't have that issue, or I didn't have that. And I really don't even know if I like that term, but I think that term can be problematic in and of itself.
If you want to own it, but if you're not comfortable with it, you don't have to use it. I agree with that.
Yeah. But I also held that, it was just the shame of even being curious about it and being open about being curious about it has been really hard for me in my like path of doing this as well, because there are times I still drink and then I feel like, oh my God, I shouldn't talk about it because I've said all these things about how I don't want to drink, and like, it's like this conflicting experience.
Oh God, it really is. And I just imagine how challenging that is to like the cognitive dissonance that it would create within us. And, one of the things that I often recommend for folks is it's nobody's business why we're choosing to not drink. Or if we're choosing to not drink, if that's how we'd like to go about it. Some of us do want to let people know. It creates accountability for us, et cetera. But lots of people choose to not drink for a million different reasons. Some of which, it might just be, I have a family history of breast cancer, so I just don't want to risk it, right? Nobody really needs to know that. And so we have to decide what feels like a fit and like within our values and within my personality and my relationships with others, like how much or how little I'm going to reveal to them about the why.
Yeah.
Yeah.
Thank you. I'm also just as like we're sitting here, I'm still just getting so many questions from people.
Oh, really?
It's just, I just want to like reiterate again, like this topic is so freaking important and people are really craving knowledge around this and craving some insight, I think, into themselves through it, because alcohol has just become so accepted, right? Like it's just this accepted thing that revolves around being a social being. And it's so hard to look at it in the mirror once you start looking at it, you can't not look at it. It's actually something I think Holly Whitaker has said too. It's like, once you have this awareness of the alcohol industry and how it profits off of people, you can't not know it anymore. So you fundamentally can never have the same relationship with alcohol, which is actually sometimes really annoying. Like it can be a burden because you can no longer like cloak yourself and pretend that you don't know what's going, or pretend that you don't see this, I think is the way I put it. So again, just reiterating this as I'm watching people like continue to keep messaging me and asking things about this, which is so great. So glad that you're here.
I'm excited.
Yeah. And this is one that just came in that I wanted to actually pivot to. And she said, and this is actually, this is of somebody from Project Heal who works at Project Heal and wants to know this for some Project Heal people. So shout out Project Heal. She asked how to explain why it's problematic for sober support groups to promote dieting. Totally. I know we're like whipping subjects here really quick, but I thought this was like a really interesting one about support groups promoting dieting, because I do think there's a cross interchange often between quitting alcohol and sober people talking about losing weight from quitting alcohol, which really frustrates me because the two are so interwoven that it's like, I think both industries need to have a really good collective consciousness about how we approach these topics.
It's going to take a lot of conversation and we're never going to be able to change everybody's approach to it. And the fact of the matter, let's just call a spade a spade. A lot of times when people stop drinking, we do see they start to shed weight, right? It happens. And so that's going to be something that a lot of people consider to be a positive. And there are going to be a lot of people out there who can do that in a way that is not problematic, right? But there are a lot of us who have this kind of dual thing going on where now it's, stopping drinking and this idea of losing weight. And it's more than that, right? It also becomes like, now I'm going to start eating healthy and whatever that gets identified as, or I'm going to start, I know a lot of people who stop drinking alcohol and start running marathons. And that is, everybody's like, yay, good for you.
I know a lot of people like that too. It's really funny.
Yeah. And it really, it for many people, not for everybody, but for many people, it's a switching of compulsion, right? And so, and those get co-signed because of our culture, because of our diet and exercise culture that is wrong, quite honestly. It's completely off base for a lot of people. And so I think we're always going to have those folks who talk about it. And so maybe the more important question at the moment is, how do I set boundaries within recovery groups that this is not okay to talk about? You go ahead and diet and talk about what you need to do over there. And this is not something that I'm comfortable with discussing. So, and I know boundaries are terrifying for a lot of folks. But really starting to be able to remove ourselves. If I'm at an AA meeting, for example, or a smart recovery meeting or whatever it might be, and someone brings that up, being able to remove myself from that conversation, I don't need to present myself to that. I can walk away. I can recognize that might work for them. That's not going to work for me. I can utilize my support system and say, oh my gosh, somebody said something in a meeting today and it's triggered all of these eating disorder thoughts. I really need to talk about it. And hopefully we can do something more systemic in terms of change. But for now, let's start setting those boundaries and not allow people to cross that line. If our sponsor starts giving us diet advice, letting them know either we need to get a new sponsor, or if they're willing to accept redirection, say, I really just need help with my alcohol use. I think that's going to be most important.
Well, yeah. And I think there's like this element too. It's like, at some point I have to take self-responsibility about what triggers me. Right. And so it's like, people can't know what's going to trigger you. So to some degree, it's like, if someone you need, like, I think I would need to be, I'm just speaking from my own personal experience, but like, cause I'm not a clinician, but from my experience, like I have to be upfront with somebody when I'm asking them for like support, and I have to tell them how to support me, because nobody's going to support me better than I can ask them how to do it. And if that means like, because I've had people say stuff to me about skincare whenever I am not drinking, and talking about how my like skin glowing and all this, all the, and which is a lovely benefit, but like, I don't need to focus on my vanity, because I focused on like my vanity with my eating disorder, in some ways for a really long time. And so it's like, no, I don't want to quit drinking just so that my skin feels better. Like I don't, that can't be like my motivating factor.
Right. I'm so glad you brought that up, Lindsay, because it's something that I talk about all the time. In fact, I gave a presentation to friends and family this morning, and I said, ask your loved ones to be explicit with the ways that are the things that you can do that help them and the things that are not as helpful, right? So, because I think most support people, they do their best and they maybe offer things that would feel supportive for them, but they totally miss the mark for us, or maybe are even detrimental. So just really being, I agree with you. We have to tell people. And for some of us, that's really scary. And it's definitely a boost to our recovery.
Yeah. And I think that leads, this whole topic kind of leads into an interesting comment. I mean, I think in some of these questions, people are asking this, but they haven't asked it as specifically as I'm trying to say it right now, I think. But like, I've noticed, there's times when I've quit alcohol for months on end, and I end up having to relook at my like relationship with exercise. Like you were saying, I struggle. It's like, I can't sit still. Like I have a really hard time. I think I'm getting in a better place with it, because I've been working at this now for a long time, but like I noticed that like my exercise compulsion like starts coming back a lot stronger, because I'm like, when I don't drink at night anymore, or I don't go out as much and socialize anymore, I'm like, well, what am I gonna do with all this time? So I'm like, well, I guess I'll do yoga, and then it ends up being too long, and then I feel like, or I'll go on another walk, and it's not even like strenuous exercise, but I find myself like antsy and like needing to like get out and do something. And I've had a lot of people give feedback on that, like the crossference of these two things, and like struggling with like, how do you just sit with yourself? Like,
right. Oh my gosh, that game of whack-a-mole can be so frustrating. And I think, you really touch on a good point, is that we have to have an awareness. So an example that is similar is if I'm in eating disorder recovery 6 months, 6 years down the road, and I find like I get to the end of the week and I say, oh my God, I've gone shopping every day this week when I don't typically do something like that. Does that mean I suddenly have a shopping compulsion? No, it means that maybe I'm avoiding something. Maybe I'm unaware of some stressors in my life and I need to take a look at what are my current vulnerability factors. Maybe there's something else going on for me. And so it just means developing that awareness and noticing, oh, I meant to do yoga as a means to contribute to my recovery. And instead, I went for way longer than I needed to, or I did it 3 times today, or, so just developing that awareness, and then, some accountability can help too with others.
Yeah. Thank you.
It's a huge deal.
Yeah, I appreciate those responses. And then, so there's kind of this flip side. I want to shift it for a minute, because I think there was enough questions that I've been getting that is worth flipping over to this other side of people who maybe purposely get drunk so that they can eat like their banned foods, like their bad foods, and not feel so guilty about it. Mm-hmm. But in my experience, because I felt that way too when I was actively in my eating disorder and drinking alcohol in college, and it was all college for me, fairly regularly. And what I found is like the actual, like the intention was eating disorder restriction, or eating disorder like blockage. But then what would happen is I would end up getting drunk and like binge eating the shit out of my fridge. At 2 a.m, and I'd hate myself, and like it was like this horrible cycle that just like would continue, and then I'd restrict the next day because I was mad at me. It was just that cycle, it's the eating disorder is what I call it, the eating disorder cycle.
It's so common. Oh gosh, and frustrating, right? And so it's and this question, I did notice some variation of it came through several times. I mean, substances do a lot of things for us. We have to acknowledge that. We can't deny that. Substances of all kinds, alcohol especially included, can quiet thoughts. They can reduce, feelings of anxiety and stress. It can allow us to kind of lose our inhibitions enough to be able to like have hard conversations with people. They can loosen our inhibitions enough to where like, oh, I can eat this food that I really enjoy, but I never allow myself to have. But the flip side, as you mentioned, is that we then kind of tend to overdo it. And if we do end up even if we don't end up binging, but we eat a food that we wouldn't typically allow ourselves, that shame and guilt and remorse the next day, or even later that night, can lead to restricting or other compensatory behaviors, purging or exercise or whatever it might be, which is part of that cycle. And so this is, again, it's a lot of times we use a substance, alcohol, and cannabis is another one that I see used a lot to, well, it helps me to eat and I have to eat. And I agree, right? Okay. Well, keeping somebody alive first and foremost is the number one thing. However, really what we want to do is get to a place where we get our hunger cues back normally and naturally, which usually requires treatment. If we're struggling that much, as opposed to relying on a substance that no one's monitoring, and can potentially get us into trouble. Lowering your inhibitions, it doesn't just happen with the food either, right? It can be, I drink alcohol and then I'm more willing to engage in like self-harm, or I engage in, sex that ends up feeling traumatic for me because I'm going to do it with somebody that I don't really even want to be with. And there's no blame there. That doesn't mean that I'm to blame for that, but we may find ourselves allowing ourselves or giving ourselves permission to do things that go against our value system and our recovery as well. And so I think it expands even beyond the giving myself permission to eat, to all sorts of other things that we'll give ourselves permission to do.
Yeah. I like that. Thank you. That's a really interesting response.
But I don't blame people, right? Because sometimes we're just so desperate. I just want to eat, and it makes sense. But I think we do want to find some way of kind of halting that cycle.
Yeah, I agree. Yeah, it's funny. I see a lot of the like the pot too. And I live in Colorado, and pot's legal here. I don't smoke pot. I feel like that's like, I have enough vices I'm dealing with in my life. Pot, for whatever reason, just has never been one. So I feel grateful, because I actually have a lot of friends that have never even had eating disorders that have a really hard time with their hunger cues because of how much pot they've smoked their whole lives. I'm in my 30s, and I have friends that have been smoking pot since we were 14. Yeah. And I think it's completely whacked out some of their ways of interacting with food.
Yeah. Yeah.
But
Yeah.
it's not really for me to just say that to them. I just watch.
I know. Yeah.
Yeah, and then okay, so here's one that's a little bit more clinical, I think. And I liked this one because I actually have never thought of this question. So I thought this one. And it's like, are there similarities between the impulsive traits of alcohol users and types of eating disorders? And I think that is a little bit more clinical based, right?
Yeah, it is. So yeah, we do see some interesting personality traits kind of crossing over. People who struggle with substance use and people who struggle with eating disorders, a lot of times both have a tendency towards increased harm avoidance. And that's why we use, right? So when I think about increased harm avoidance, I can't manage these feelings. So I need to use a substance to calm them, or I need to engage in my eating disorder to provide some relief. So the engagement in our behavior or our alcohol use is to avoid that feeling of harm, whatever that means. And that's a very broad kind of category. So one of the tricks in treatment, whatever that looks like, is to increase our window of distress tolerance so that we can sit with that feeling of anxiety or discomfort and not feel the need to use to make it go away. It doesn't feel good. It's not fun, but it's also great to start to teach ourselves that our head is not going to explode if we don't use alcohol or if we don't engage in our eating disorder, and that we can manage it. And we start to increase that window of distress tolerance, which allows us to not shoot straight up into anxiety quite as quickly. And the opposite side of that would be like the hypoarousal, which would be kind of sinking into that like isolated, withdrawn kind of depressive state as well. So we want to increase that. The other, another aspect that we see is a decrease or lower self-directedness with people with substance use as well as eating disorders. And what that really means is I have an external locus of control. Things happen to me. It's because this happened that I now have to do this. And so really increasing our responsibility over our words and our actions is really important to address that. And then the other thing that we see, particularly with folks who struggle with bulimia nervosa, would be increased novelty seeking. So, jumping out of an airplane, with a parachute, we see, and that's, experimenting with a bunch of different drugs, that's increased novelty seeking. It's kind of, for those of you who have some understanding of over-controlled versus under-controlled, it's that kind of more under-controlled side of things. So those are a few of the similarities that we see between the two. It's a great question.
Yeah, that's really, I love that about the novelty seeking. I've never heard it put that way, but I think there's novelty seeking that I had even in the eating disorder, because I felt like I lived in the cycle. So I was often pretty impulsive, like a lot of things were just these constant responses to any kind of trigger, any kind of like stress induced anxiety, or even to some degree, like not stress, like everything. I just used it it was a response to everything. It was a response to like the love dopamine and like oxytocin, like it was a response to everything. And it also, when I look over the course of my life, has caused me to make a lot of like novelty seeking choices because I want that high. I think like I was like looking for even more of a high all the time of like doing something crazy. I didn't jump out of a plane, but stuff like that, like that same kind of thing. Yeah.
Looks different for everybody.
Right. It looks different. What's novelty seeking to everybody is different. And that's what I thought was interesting too. How might a parent's use of alcohol impact the development of an eating disorder?
So that one is interesting, and I'm really glad that came up. So one of the things that I like to note is that if my parents, and I think the actual question was like parents' alcoholism or something like that. So I think we're talking probably some pretty severe use or regular use. We might, as a kid in particular, use our eating disorder behaviors to give us a sense of control when everything feels really chaotic. We might use it to help us numb or withdraw or avoid. We might use our eating disorder to manage trauma reactions that we're having that are, a result of our childhood and our upbringing. But there's also, the genetics, right? So our genetics, our parents may pass down genetics for addiction to substances, and growing up in a household where people are maybe drinking in a way that is problematic for us, we may say, I don't want anything to do with that. And then what we find happens is our genetics just express themselves differently. So in an eating disorder, for example, so the genetics come to play as well. And there isn't anything that we can do about genetics. We can't change genetics. But certainly recognizing that the environment we grew up in absolutely impacts us and impacts the development of these things. And one of the things that both substance use disorders and eating disorders absolutely have in common is there's typically some kind of trauma in the background, or in the history. So I think that that's typically where we're seeing a lot of that develop.
Yeah, that makes sense. Thank you. Yeah. Okay. So I feel like we've gotten through some of these bigger questions. I'm looking to see last minute if there's any last minute ones that have come in that maybe we could look at that, because I feel like we've addressed a pretty wide scope here, which is wonderful. So thank you for that. I think you kind of addressed this one, but just to like wrap it up with this one, and then I want to go into recommendations, because I have quite a few too, and I know that you do as well. And we work with quite a few lovely humans in this world that have some great books out there as well. But if this last one, I just thought, and again, I think you kind of already answered it, or did answer it completely. But if I use alcohol to deal with trying to stop an eating disorder, do I have to stop drinking in order to fully recover from the eating disorder?
Right. Yeah, I think that kind of ties in with like the very first question, right?
Exactly.
So not necessarily. And again, and I think I'm glad you're bringing it up again, because I think it bears repeating. I really recommend early eating disorder recovery, that we try to avoid using substances if possible, just to give us some time to get our sea legs, to make sure our medications are working the way that they need to make sure that we're practicing the coping skills that we're learning through treatment or therapy or whatever it might be, instead of relying on alcohol to de-stress at the end of the day, trying to work on some of our coping skills and some of our self-care and some of our connection with others and that kind of thing. So
yeah, and I just want to cement that into that. I think it's really hard to cement good coping skills if you're still actively like drinking quite a bit, because what I noticed, and this is just my experience, but what I noticed is like most of my time in New York, those first couple years, I wasn't doing self-care actively. I was eating, but like I was doing recovery. I was in recovery, but I was like not developing any really other coping skills other than continuing to drink wine when I had a bad day. And that's what I did. My coworkers and I would go across the street, we get wine, bitch about our jobs, and shout out to my old job, but and then leave and go back home. And then it would just be kind of like, what did I do? What did I do to cement in anything for myself? And so at some point, that's what made me start on my journey, was that I was like sitting there one day and I was like, I have no hobbies. Like I don't have anything but work and drinking at happy hour and occasionally working out at the gym. And I just felt like I was really bored with myself, if that makes sense. Like I just I wasn't passionate about anything anymore, other than writing, which was the only thing I had, but it was writing about eating disorders. And I was like, I felt like I didn't have life, hobbies, just like life skills, that kind of is what has been leading me down this like sober curiosity for a long time, because I think alcohol does get in the way of us finding coping skills and more or less us finding adventure and hobbies and other things that we can spend our time and our energy on. Because I certainly wasn't doing a whole lot of hobbying when I was drinking, because it's like I got drunk and got tired or went to bed. And tried to like not feel terrible the next day, which also can go on for days, and then I'm too tired to do anything else except for be hungover.
It doesn't leave a lot of room.
So thanks. That was one I just wanted to, and again, it is like the first one, but I like the way it was phrased, which is like if I use alcohol to deal with trying to stop an eating disorder, do I have to stop drinking to fully recover? So thank you for that one. And then I think let's touch base on recommendations for people. And can I throw out a couple first too while I have them on my head? Okay. So obviously I've already talked about Holly Whitaker. She's at Holly on Instagram, and her book Quit Like a Woman changed my life for sure. It's one of those books that caution, once you read, like I said earlier, you really can't look at alcohol ever the same, for better or for worse, but for better, but it's her memoir too, to some degree, but she's done a lot of research and brought in a lot of different statistics and facts about the alcohol industry and how the alcohol industry targets, especially, women over or people who identify as a woman, more so than more so than anything. And it's why we have mommy wine culture and all this other stuff that is now such a stable thing.
Yeah.
Rose all day, all these catchphrases.
Yeah.
And so that one I would say Laura McCohen's, never heard her say her name out loud, so I think it's Laura McCohen. Her book We Are the Luckiest, also really beautiful. How to Stop Drinking by I think it's Alan Watts is another one that it was more clinical a little bit, or it was a little bit more, it was less like memoir-ish, but I really enjoyed it when I've been reading that one. And then I know y'all mentioned this one too, Robin Cruz, who is a wonderful advocate for ERC and Pathlight. She's an amazing lady. And she also talks quite a lot about sobriety, especially sobriety as maybe not like a 20-year-old, but as an older woman. Who's, like, and that's where I feel like I'm headed too, is like what happens in your your drinking in your 20s is quite different than drinking, or like drinking in college is different than drinking in your mid 20s, because it's just the way the culture's made it be. And I'm now in this drinking in the 30s age group of trying to figure out that. And she is in another age group too. So for any of our older listeners.
Yeah, absolutely. I would also recommend, for those of you who are interested in doing some harm reduction, there's a book called Over the Influence by, oh gosh, hold on, I'm going to have to look this one up. Jeannie, I've got it here. Jeannie Little and Pat Denning. So it is a harm reduction approach, and it kind of takes you through it's very, it's clinical in that regard, but not like lingo and jargon. So, you can read it. There are some exercises that can help, if you're kind of not sure, that can be really helpful, and you can start to kind of parse that out. And, just fair warning here, at the end of the book, if you have not managed to kind of get yourself to a place where you're able to drink in a way that feels responsible and in line with your values, et cetera, the outcome may be that you may need to be somebody who's abstinent, right? But I think a lot of us need to kind of go through this process to figure it out. So that can be helpful. The rest of my stuff is really all like really great accounts on Instagram. We've got FK Drag. That's Eric Dorsa is amazing. He's another one of our advocates. For anybody Black, trans, and sober, we've got it's at l.nuzzles, Nuzzles. And then we've got a few other, Robin, of course, you mentioned. And then there's a website, again, for people of color, soberblackgirlsclub.com. There you can really take a look for all of these, and maybe we can even add a few of these on Instagram. But at The Lovely Becoming, at Nutrition Tea, Shayla Martin, Sober Voices, all of those can be really helpful in terms of kind of just going with somebody on that journey, and somebody who's been there, done that as well.
Yeah, Annie Grace is also on there that I can read. There's so many. So really, I feel like, I'll try to tag some in these. And also, if anyone who's listening right now wants some others, feel free to reach out, because I think we have a whole list on the ERC and Pathlight. Yeah. So feel free. Therapy with Women. I did an Instagram live with her recently on drunkorexia, and she's been sober for 5 years, and she talks about that a lot too. So there's another one.
Great. That's great. It's awesome. There's a lot out there. And so I think it's helpful to get recommendations from like Lindsay, because we want to make sure that the messaging is lining up with eating disorder recovery, with sobriety, et cetera, that kind of thing. Because there are a lot of people out there who've got like a lot of sober stuff, but they're all focused on losing weight and, that kind of thing. So we really want to be cautious about if that works for them, that's great, but that may not work for a lot of us.
Yeah, it's such a good point, because when I first was like going on Sober Curiosity, I was like following every sober, like I was like literally looking up the hashtag sober and just like following everybody. And then I was like, wait, why am I seeing so much weight loss? Like, why is my like explore page now back to like transformations from like all those before and after sober pictures, and then them like adding in their weight loss, adding in like I was like, it's too much. So I ended up having to go through and like unfriend, and then all of them about their workout regimes. And so I was like, oh my God, how did I do this? So I like screwed up my whole explore page, and it's still like not normal.
Oh God.
So yeah, I'm a victim of doing that exact thing. So
well, we just want help. We just want help, right? And then some of the voices are going to be helpful for us, and some are not. And
right.
Yeah.
Thank you for that.
Of course.
All right. So really, thank you so much for this conversation. Yeah, thank you for coming on here and doing this. I feel like this is such a good time to be talking about it. Like we said, I appreciate it. And if anyone has questions, reach out, or if anyone wants to, speak to someone at ERC, I don't want to put you out there directly because you're a busy person. But I will tag you in it. So if people, I don't know, are you comfortable with people following you if you needed that or not? Okay. It's like I didn't know if it was private or not. Okay. So there's
lots of pictures of my kid, but but yes.
Okay, perfect. Thank you, everybody.
Thanks, everybody. Thanks, Lindsay.
Thank you.